Hello everyone. My today's discussion topic is Argus tabs. Firstly, in Argus, they're having total 9 tabs are used for the reporting or for the case valid all that thing. So a total 9 tabs we use in Argus. Then we see all that tab in detail. Then first tab, that is the triage. In triage we mainly check the three things, and first thing, that is the valid case or valid criteria of the case. In valid criteria we check the fourth thing, that is the identifiable patient, identifiable reporter, suspected drug, and the suspected reaction. And when the case follow all that 4 criteria, then we move to the duplicate search. What is the duplicate search and what's the meaning of duplicate search? A duplicate search means is that when we administered the drug, that time we occurred some we observe or we occurred some side effect or adverse effect. Means the drug is not suitable for us. That time we report to our pharmacist, and that time we generate some adverse event report, and the pharmacist also generate some adverse event report. But your reporting time is 9 o'clock and the pharmacist reporting time is a 9:50 or 9 there's something range. Means you report first, then pharmacist report second, and both report is same. It's only report that you caused some side effect, and that time the first report is the first report is considered, that is the duplicate search. Means in some time the two report are generated by the same patient. Means they are having the patient name, patient history, the patient adverse effect is same. So that time we select the one report, the report consider at before this report we consider first as compared to second report, that is the duplicate search. And in a third that is the seriousness timeline. Seriousness timeline in a USO they are having different seriousness timeline, and in India they are having different seriousness timeline. So our main the three work are done in a triage tab. Then next we move to the patient then next we move to the general tab. In a general tab, they're having all the information related to the patient, related to the reporting date, reporting time, and then all that reporting information are received in the general tab. In general tab, they're having initial and follow-up report are also checked, that is the general tab. Then next, that is the patient tab. In patient tab means patient report their report, patient report their adverse event report. That time the patient mentioned their all thing, so we only check in patient tab. We only check all that thing, we do not add it any other thing to that. We only check patient report, and we consider all the patient thing. In a patient tab we don't add it in our anything, that is the patient tab. And in patient tab also check the patient history. Means patient having any pregnancy or a patient having any concomitant medication, patient having any other related problem to the history, that all thing we check in a patient tab. Then next move to the event tab. Event tab is that firstly there is a product tab. In a product tab all the product information, means the side effect, the adverse effect, all that thing we use in a product tab. And in a product tab we mostly use the WHO DD, that is a WHO dictionary we use in a product tab. Then next, that is the event tab. In an event tab the patient caused some side effect, so we mainly focus the signs, symptoms, and side effect in an event tab. Then next, that is the analysis tab. In analysis tab the narrative writing is done. Narrative writing means short summary, or we report the short summary to all of report, that is the narrative writing, analysis tab. Then next, that is the activities tab. In an activity tab, if sometime we forget something in a before information, that time in an activity tab they're having the chance to check all that information. If we forget some information, that time we added that information in activities tab, that is the activity tab. Then next, that is the additional information tab. Additional information tab means they're having the patient summary, hospital discharge summary in that, that is the additional information tab. And then last, that is the regulatory report tab. In regulatory report tab we submit the report, that is the regulatory report tab, and that's all about the Argus tab. Thank you.